Hey there. Welcome. My name is Dr. Calliope. I'm going to be performing your examination today. Would you mind if I just grab your name and date of birth? There we go. Okay, what was that date of birth? Okay, great. So I have here that we are performing a head and face exam today, correct? Okay. Is there any particular reason that you wanted to do this examination? Okay. Sounds good. Are you having any pain or any complaints at all right now? Okay, sounds great. And any changes to your medical history or medication list that I should be aware of? Okay, wonderful. So let me go ahead and put this down, and I'm going to sanitize my hands. We'll go over what we're going to be doing today, okay? Great. Now, I'll have to warn you, it is a little noisy in the office today. So, unfortunately, there may be some outside noise, but I just want you to ignore that. That shouldn't have any effect on our examination today, okay? Alright, there we are. So we are performing a head and face examination today. What this is going to involve is I'm going to put on some gloves. We're going to look at your head, your skull, your scalp. We'll look at your face, your mouth, your nose, eyes, ears, throat, lymph node area. Okay? Do you have any questions for me before we begin? Okay. And do you mind if I touch you? Do I have your consent? Wonderful. Okay. Let me go ahead and pop on a pair of gloves and we can get started. Did you get to the office okay? Yeah, I don't think we were supposed to get snow today, so that was an unpleasant surprise, but you made it here okay. That's all that matters. There we go. I think we're supposed to get 60-degree weather tomorrow, so a little different than snow and 30 today. It's hard to get these on without any powder. There we are. Okay, we're all gloved up, ready to go. So, from time to time, I will be jotting some notes down and referring to my clipboard. Don't think anything of it. It shouldn't make you anxious or worried at all. I'm just taking notes for my reference. If anything hurts at all, if there's any discomfort, please let me know, okay? Okay, great. So I'm just going to stand back here, and I'm just going to take a little note of what you look like, any asymmetry, anything I notice. Okay. Alright. Looks normal to me. So I'm going to come in and I just want to have a bit of a closer look here. Okay. You said you haven't noticed any complaints at all? Haven't suffered any injuries? Haven't gotten a bump on your head? Nothing like that? Great. It's good to hear. Okay. Well, I'm going to start by going ahead and palpating your skull a little bit. So, again, if there's any discomfort, please let me know. Just want to make sure that all the ridges and indents and bumps and contours of the skull are normal, even. Okay. Looks really good. Okay. Now I'm going to be looking at your scalp a little bit. I'm just going to rifle through your hair a bit. So I'm going to get a little closer here. I'm just going to take a look at the hairline. Part your hair a bit. Make sure the hair growth is normal and even. There's not any balding spots, no injuries. Okay. I'm going to go to the back and I want to look at the back of your head, okay? I'll be just a moment. Alright, that looks good as well. Wonderful. Okay. So I'm quite pleased about that. Okay. Let me take a look at your face then. Okay. Noticing any scarring or abnormalities. Have you had any problems with psoriasis or eczema, flaking of the skin, acne, anything of that sort? Okay, any itching or irritation? Okay, well, that skin seems to be pretty nicely textured. Looks clear enough, even coloration. Now I'm noticing a scar right here. Have you had that for a long time? Is that new? Okay, that's been there a while. Comes with a package, right? And let's see. There is a mole right here, although really it just looks like a dark freckle here, but yeah, I think we'll keep an eye on that one, okay? Okay. Are you wearing sun protection, sun hat, sunscreen? Okay, so that's very, very important. Even on cloudy days, you should be wearing sun protection, okay? In addition to helping you not look older than you are, it also helps you stave off any nasty little skin lesions or cancers or what have you. It's just a good idea all around. So, give me one moment. Just going to take a few notes here. So we're going to do a quick little test of a couple of your cranial nerves. So firstly, we're going to test your trigeminal nerve. And the trigeminal nerve governs the facial sensation. So we're going to test this in a few different spots. I want you to close your eyes for me. There you go. Close your eyes. I'm going to be touching you on different parts of your face. I want you to tell me where and what side, okay? There. Good. 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 Wonderful. You can go ahead and open your eyes. I'm going to be touching you on both sides of your face. I just want you to tell me if each side feels equal or one feels different than the other, okay? Alright. We're going to go up here right beside your forehead. Okay, and right there. Does that feel the same or different? Good. And right here. And right here. Okay. Does that feel the same or different? Good. And right here along the jaw. And here. Wonderful. So everything's normal there. Now we're going to test your facial nerve. So this is going to be some facial movement. I'm going to ask you to do some kind of goofy things. Just follow along. So I want you to first raise your eyebrows. Okay, very good. And if you could furrow your brow. Very good. Okay. Can you smile real big for me? Okay, great. And can you close your eyes very tightly for me? Good. And can you puff out your cheeks? Great. Okay, that seems to all be intact. Okay. So we're going to be doing a short little examination of the ears now. Firstly, I want to inspect them, make sure that they look normal without any irritation or abnormalities. There's no discharge, anything of the sort. Then we're going to take the otoscope and do a little bit more of an in-depth examination, okay? All right. Have you had any ear pain at all? Have you noticed any itching or swelling or changes to your hearing at all? Okay, great. All right. So I'm going to go from one ear to the other. I'm going to first examine the outsides of the ear, and we can go from there. Okay. Right. So we're going to start over here. And what I'm going to do is just palpate the pinna. And we're going to just look at the coloration. The skin looks nice and clear. Just from looking at the outsides, there doesn't seem to be anything of note. Okay, I'm going to pull up and back on the auricle here. Do you notice any pain at all? Okay, good. Let me go ahead and release that. Alright, let's take a look at the other ear. Okay. So again, nothing noteworthy here. The skin looks normal coloration. There's no discharge. So I'm going to pull the pinna a bit. There's no pain there, correct? Very good. Now I'm going to pull up and back on the auricle. Notice any pain? Very good. Okay, great. So that looks all normal. So I'll just be a moment and let me get my otoscope, okay? Alright, so we have the otoscope here. Just going to pop out a speculum. We use the largest speculum we can. Put that all back together. Okay. So please note that all of our instruments have been sterilized beforehand, so you don't have to worry about any of that. And we have light. Very good. Okay. So this time I'm going to pull up and back on the auricle again. And we're going to take a look inside. I'm going to look at the ear canal, the tympanic membrane, the little hairs inside the skin. Okay? Let me know if there's any pain or discomfort. Alright. Start over here. So I'm just going to go ahead and prop my hand on your face here. We're going to go ahead and insert the otoscope into the ear canal, and I'm going to have a look here. Okay. So everything's looking clear. And the tympanic membrane is a nice pearly gray color. You can see the cone of light. Everything looks intact. There's no irritation, no swelling. Okay, go ahead and take that out there. We're going to take a look at the other ear. Okay, let's go ahead and pop the otoscope in. There we go. And have a look here. Let's see. Yep, the ear canal looks very clear. There's no obstruction, no irritation or swelling. Tympanic membranes, pearly gray with cone of light, intact. Okay, go ahead and pop that out. Alright, let me take a few notes, please. So we are going to do an auditory acuity test. Essentially, this is a little mini, very mini hearing test. I'm going to be whispering numbers into each ear. I just want you to repeat back what you heard, okay? Okay, so if you wouldn't mind closing your eyes. And then when I whisper, go ahead and tell me the number that I said. Okay? Very good. 55. Great. 62. Good. 11. Mm-hmm. 24. Good. 35. Good. 69, dude. Wonderful. That's great. So we're going to do one last little test, and what I'm going to be doing is rubbing my fingers together, little finger rustling. I'm going to do this on one side or the other. I just want you to tell me which side you hear it on and when it stops, okay? Great. Good. 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 Excellent. Brilliant. Bodacious. Wonderful. Awesome. Okay, great. That concludes that. Give me just a moment. Okay, now we're going to be using some tuning forks here. We're going to conduct two tests. We're going to do the Weber and Renee test. So I'm going to grab our tuning fork here. We'll first do the Weber test and then the Renee. So I'm going to strike this tuning fork and I'm going to place it in the middle of your forehead. Okay? What I want you to tell me is whether you hear the sound more in your left ear, your right, or right in the middle, okay? Right in the middle, okay? Let's try that one more time. Right in the middle, wonderful. So now we're going to do the Renee test. I'm going to strike our tuning fork and I'm going to put it behind your mastoid process. On your mastoid process, rather. And I want you to tell me when you hear it and when it stops, okay? Then I'm going to bring it to the front of your ear. You can tell me if you hear it and when it stops, okay? All right. Stops. And still hear it, okay? One more time, behind the mastoid process. Do that again on the other side. Okay, very good. And alright, then it stops. Good. Alright, behind the mastoid process. And stop hearing it. And right there still. And stops. Very good. So we have 2 positive Renees and a normal Weber. Okay, Renee positive, Renee positive, and Weber normal. Okay. Right, let's go ahead and take a look at those gorgeous eyes there. Now I want you to look just straight at me, and I'm going to come in, and we're firstly going to look at the skin around the eyes, and the physical eye itself. So, not noticing any bags under the eyes. The skin looks not irritated, not swollen at all. Okay. Skin looks normal. Sclera looks good, clear white. And let me go ahead and I'm going to pull down on your eyelid. I want to look at the conjunctiva. I want you to look up for me, okay? So firstly here, I want you to look up. Very good. Okay, go ahead and look down again. And now again, look up. Okay, very good. Very good. Discharge from the eyes. The lashes look normal. There's no styes or cysts. Okay, very good. I'm just going to take my pupil gauge here, right here. I just want to note how big the pupils are and what size they are relative to each other. Okay, very good. So now we're going to do a little light test. So this is a very gentle light, but it may be a little bright to you. So we're going to do a little test called direct and consensual. So I'm going to be shining this light into your eye, and then what your eye should do is it should restrict according to the light. But in a consensual response, the other eye will also follow suit, okay? So you don't need to do anything. I'm just going to put my hand right here and come in obliquely like that. Direct. Consensual. Consensual. Very good. Consensual. Okay, do that one more time. Direct. Consensual. Consensual. Very good. Direct. Consensual. Consensual. Okay, very good. We're going to be doing a little visual acuity. So we're going to be looking at this Snellen chart right here. I'm going to point at a line, and I just want you to repeat it for me as best as you can, okay? So, firstly. Good. Good. Okay, let's go ahead and do a little jump. Good. Okay, and another jump. Now I want you to cover one eye, doesn't matter. Okay, go ahead and cover your left eye then. And let's go ahead and do this one again. Let's do it backwards. Great. And if you want to go ahead and cover your right eye for me. And we'll do that one forwards. Okay, wonderful. Thank you. So now we're going to test your vision here a little bit. I'm going to ask you to cover an eye, and I will cover the same eye as it is to me, and we're going to have you tell me when you see my fingers come into view. Okay? Okay. Go ahead and cover that eye. There you go. Okay? Now I just want you to tell me when my fingers come into view. Okay? Good. 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 Mm-hmm. Mm-hmm. Good. Good. And now the other side. Good. 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 Wonderful. Excellent. Okay, so now I'm going to test your peripheral fields a little bit. And I want you to go ahead and look straight at my nose. And we're going to do that same little wiggle test. Just tell me when it comes into your field of vision, okay? Look straight at my nose. And good. 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 Very good. Just take a note real quick. We're going to do another visual test, and this is what we call follow the light, or sometimes the H test. So I want you to focus your attention on this light, and I'm going to be moving it around, and I want you to follow this light with your eyes, and only your eyes, without moving your head, okay? Great. Keep your eye focused on the light. Just follow the light. Follow the light. We're testing how your eyes can move all different directions, making sure they can move diagonally, up and down, side to side. Just follow the light. Follow the light. You're doing wonderfully. Okay, very good. Now I'm going to bring this in. I want you to just keep your eyes focused on the light. And back again. Okay, one more time. Back here. And inwards follow the light. There we go. Very good. Accommodation looks great. After I finish up writing our results here, we're going to do a little examination of the neck. To get started on the other side here. I'm going to be palpating around your neck, the bottom of your jaw. We're going to be looking at the lymph nodes, the parotid gland, all around, okay? Okay, please let me know if this is uncomfortable, painful. Okay. Have you noticed any enlargements or any trouble swallowing? Anything like that? Okay, wonderful. Okay, that looks good. Now I'm going to go behind you real quick. I want to feel your thyroid. So I'm going to stand behind you and put my hands on your neck, and then I'm going to ask you to swallow, okay? Okay, I'll be just a moment. Okay. And if you want to go ahead and take a swallow for me, please. Very good. Okay, great. I want to check your range of motion here. So would you mind going ahead and tilting your neck down to touch your chest? Good. And now all the way back. Good. Now can you turn your head to the left? And then the right. Good. Have you bring your head back to center, and now I'm going to have you turn your head, but I'm going to try to push against your head, okay? Don't let me. Okay, if you want to go ahead, turn your head. Very good. And turn your head. Very good. Okay, great. Okay, so now I'm going to have a look at your nose. I'm just going to come in closer and look at the nose itself. There's not any redness or swelling. You've never broken your nose, anything like that. Very good. Okay. Do you snore at all? Any issues with that? Any allergy issues, sinus issues? Okay, very good. I'm going to palpate a little bit on the nose. Okay. I'm going to tap on your sinuses a bit too. Any pain? Very good. Okay. All right. Going to take my speculum and my otoscope here, and we're going to look inside of your nose. I know, not very polite, but I just want you to tip your head back. Okay. And we're gonna have a look here. All right. That looks good. Here. Okay, very good. Right, quick and easy, right? I'm going to hold one side of your nose, and I just want you to breathe normally for me. Okay, breathe. Very good. And then the other side. Breathe. Very good. Now, lastly, we're going to take a look at your mouth, your lips, and your tongue, and your throat. Okay? I'm just going to have a look here at the mouth, the lips, look for any dryness, any cold sores, anything like that. Okay, that looks good here. It's going to palpate a little bit. Have a look at the inside of your mouth, okay? Go ahead and open wide. Just want to take a look at the gums, the teeth, oral mucosa. It's all looking very good. Oh, it looks like you bit the inside of your cheek there. Nervous habit. I do the same. Okay. Very good. Now, I'm going to have you open real wide. I'm going to press down on your tongue here. I want to have a look inside. Let me go ahead and get light. would you mind lifting your tongue to the roof of your mouth there? Okay, very good. Yep, underneath the tongue looks great. Okay, now would you mind sticking your tongue out for me? Okay. Alright, so it's looking a little pale and dry, and you have some scallop marks on the edge, which is actually pretty common. I myself have a scallop tongue, but means that you're pretty dehydrated usually is the most common answer. Could also be because your tongue's just a little big for your mouth, so that scalloping is your tongue resting against your teeth. It's going to be a little odd, but I'm going to palpate the tongue as well. Okay. Alright, now I want to see a little movement from you. Can you stick out your tongue and go to the left? And move it to the right. Now you can put your tongue back in your mouth. Can you sink it into the side of your cheek? Okay, good. And the other. Very good. Now if I press on that, go ahead and resist that. Good. The other side. Very good. Okay. That looks great. Just going to make some last notes here. So everything looks great. I didn't notice any abnormalities, anything we should be concerned of. As far as I am concerned, you are healthy as a horse, and you can leave and go home knowing that there is nothing wrong, at least from your shoulders up. Good. Yes. So, thank you so much for coming in. My name is Dr. Calliope, and if you need anything or if you're concerned of anything, you can give us a call at any time, okay? Okay? The gals at the receptionist desk will get you all checked out, and you are free to go. Okay. I hope you have a whale of a day. We'll see you another time.